We've seen now 14 breaches of hotel quarantine over the last since October last year, several since the beginning of the year. Almost all of those have been related to variants of concern, and that has led to various actions, including what's happened in Perth over the weekend. So this is continuing to be a threat from overseas, and our objective has to remain to keep Australians in Australia safe. That has got to be the fundamental element, and that's what I was asked to give advice upon. Over the last couple of weeks, as we've seen on one other occasion in the last year, we've seen a very rapid rise in the percentage of positives in our hotel quarantine system, particularly but not only in Howard Springs in the Northern Territory. And so action needed to be taken. And so we were asked what was the problem and what could be done to fix it, and that's the advice we gave.
So can hotel quarantine systems only handle 2% of positive cases? Is that correct?
So that's the benchmark that we agreed with the states and territories very early on in this pandemic, and it was the advice of the Australian Health Protection Committee at that time that that would be a benchmark of concern, that we should take action once we got to that level. And in Howard Springs at the moment, it's over 15%, of which over 70% of them are people that have arrived back from India. So I think you can get a sense that where the issue was, and why action needed to be taken. We need to make our quarantine systems as safe as they can, and in particular in the Northern Territory, they do have limitations in their healthcare for Territorians. I've worked in Darwin, and I know that that hospital, the Royal Darwin Hospital, is almost always full, and so we need to take those things into account as well.
Just one final question. What responsibility do you have to those 9,000 Australians in India who are at great risk of contracting COVID?
So, of course, this has been a very difficult decision of government to make this decision, particularly for those 9,000 Australians that are in India. And my heart definitely goes out to them and to their families that are here as well. Just to very much stress, this is a 2-week pause. There will be a lot of work that's done in that 2 weeks to make sure that we can resume getting Australians home from India, and that's a really important component of this, and why that 2 weeks was necessary.
So the government says that will just be reviewed in 2 weeks. Are you guaranteeing that that will change, or your advice will be that that will be lifted in 2 weeks so those Australians don't remain stranded?
So we'll continue to give advice based on the information that we have and the data that we're collecting, not only here but also in India, in relation to the pandemic there, and different ways that we can look at decreasing the number of positive cases coming home from India. And so we'll continue to do that. The actual instrument under the Biosecurity Act, which was signed on Friday night, is for a 2-week period. It stops. On the 15th.
All right.
So there may need, if it needs to be continued, that'll be a whole different process.